Click subscribe and bell icon to get regular notifications.
This is Dr. Venugopal, liver transplant and hepatobiliary surgeon from Yashoda Hospital, Secunderabad. Let us talk today something about liver tumors. A tumor means a swelling of the liver, and these are very pretty common in the population. Many a time these tumors are incidentally discovered on a scanning when it was done for some other things. Most of these common swellings are known as hemangiomas, which are the commonest blood liver tumors, and they are usually harmless and they can be left alone. But it can sometimes also be malignant or be a cancer, and in some circumstances it can also be a swelling which can later on lead to cancer, or sometimes it is indeterminate. Now, how to test this one, how to diagnose them early? So one, like I said, as when you find something on a testing for some other reason, this is the commonest one. Or sometimes they might have symptoms like you have some heaviness in the upper abdomen, or fullness, sensation of fullness, or early satiety. You become full after eating a small quantity of food. Or sometimes you can have a swelling in the upper abdomen also. Sometimes you can also have jaundice, a generalized swelling of the abdomen and swelling of the feet and loss of appetite and weight loss also. So it all depends upon what is the cause of this swelling. Now in general, these swellings or tumors can be benign or harmless, non-cancerous. Or sometimes they can be of the other variety which are cancerous, which are obviously very disturbing. Symptom wise, there is nothing much specific to like a harmless one or a malignant one. Most of them by virtue of size, especially in the benign tumors, like what I said, they have heaviness and all, and they might not have any jaundice. They just come after a few days of having these symptoms and get tested. Whereas a malignant one, especially if they are very close to the bile ducts which drain the liver, they can present with jaundice, or they can sometimes have tumors of the biliary tree also, like from the gallbladder or from the bile ducts, they present with jaundice early. Sometimes if they present late, they can even present with abdominal swelling. So once a patient comes to us, we need to know what is this swelling, whether it's benign or whether it's malignant. The most common test performed is an ultrasound of the abdomen, which gives us a fairly good idea about what it is. Sometimes, and most of the time, it is always necessary to corroborate it with another scanning which gives more information, like a CT scan or a MRI scan, or sometimes both. Now, a ultrasound is always a first step. Many a time, because it's observational dependent, sometimes most of the time it can be accurate, but sometimes it can be wrong. So it is very essential that we diagnose it properly. We cannot miss a malignancy thinking it to be benign. That is what we should always remember. We can miss a benign tumor, but we should not miss a malignancy. Now for that, a detailed evaluation is necessary. The second test which are usually done are the blood tests, which may or may not be specific. The common tests are like a liver function test and certain tests which tell about certain substances in the blood known as tumor markers. These tumor markers are usually in the normal range in a normal person, but when elevated can give a high degree that there is some malignancy somewhere in the body. So this will help us in guiding the next test. Now once all these tests are done, you have, most of the time you can arrive at a diagnosis, but sometimes still the information is inadequate. Sometimes we need a biopsy to know whether it's benign or malignant and help us in guiding the further treatment. Now the treatment can be, most of the times if it is a benign or if it is malignant, usually for tumors of the liver, surgery is always the best chances, where a portion of the liver is removed along with the tumor. It is very important that we remove the tumor in its entirety. Then only the results will be good. If any part of the tumor is left behind, the tumor can come back earlier, or it can still remain or persist in that, causing problems. So this can fairly be planned by a good imaging and a proper surgery to remove the tumor completely. If it is benign, now after we remove all these tumors, we always send it for a biopsy, and if the biopsy says it is benign or no cancer and the patient recovers well from the surgery, it is a cure for lifetime. Whereas if it is a malignancy, then the further treatment needed or not depends upon what type of tumor it is, what is the stage, whether it is confined to liver or spread to an adjacent adjacent area or something outside the abdomen. So this depends upon the biopsy report. Many a time if it is a malignancy, they can require a radiation therapy or chemotherapy or both, depending upon the type of tumor, in consultation with a medical or a radiation oncologist. Now if it is benign, we just need to do a certain follow-up studies to make sure that the operation recovery well and there is no further need of surveillance. But suppose if it has been malignant, we need to check the patient periodically to see whether this tumor has come back. And if it has come back, a institution of early therapy can sometimes give us still favorable reports. One thing we need to remember is these malignant tumors, especially the liver cell cancer or the hepatocellular carcinoma, is predominantly arises in liver which has already been damaged, like a cirrhotic liver. Now the common causes of cirrhosis are viral hepatitis, alcohol damage or fatty liver damage, or what we call as obesity metabolic syndrome. Now in these instances where the liver is damaged, and we do know that liver is damaged, we always keep them on 6 monthly scanning and blood tests to detect this tumor early so that a proper treatment can be instituted and the results are good. Now lifelong for surgical, sometimes if it is not amenable to surgery, only 20 to 30% of the patients with cancers are amenable for surgery, either by virtue of it being spread within the liver or within the abdomen or outside the liver. So in that circumstances, we have options of giving chemotherapy depending upon the tumor or sometimes a radiotherapy. Nowadays, specialized forms of radiation therapy delivery are available where the results have been quite acceptable and reasonable. Sometimes a combination of both are also needed. Sometimes when neither of them is feasible, then sometimes a chemotherapy by means of medications is also possible. So overall, I will say that if at all we have a swelling in the liver, it is always very essential to arrive at a proper diagnosis, whether it is benign or malignant, so that proper treatment schedule can be planned. If it is benign, many a time it can be observed, it can be treated by observation alone, but sometimes by virtue of its size, symptoms, we need to treat. These benign tumors can sometimes have some complications by virtue of their size, or sometimes can even rupture, precipitating an emergency where instead of surgery, you might institute a radiologic method to control the bleeding. So it all depends upon what tumor we are dealing and at what stage we are dealing, and whenever we are considering a treatment option, we should also consider the fitness of the patient for that particular treatment option. So that is all for now. I hope all of you will take care of yourself well.